Hey guys, today we're going to be talking about the stoplight system that I often use with my clients. Just like a traffic light helps us navigate the roads, the traffic light that we use is going to help us navigate our recovery, our pain, returning to the gym, sports, or a specific activity. Helping you better understand what movements are safe, may need to be modified or avoided temporarily during our plan of care as we're addressing the underlying cause of their symptoms and their pain. Empowering you, helping build some confidence and resiliency along your return. It helps put our clients in the driver's seat and take control of their rehab and their journey back to doing the activities that they love. This stoplight system and analogy is going to be used during our sessions, may be used at home when you're doing the program that we put in for you, or it might be used as you return back to the gym and other activities. So to better understand the stoplight analogy, we have to understand the pain scale. 0 to 10, 0 being no pain and 10 being the worst pain that you've ever experienced, and 5 somewhere in the middle. The green light is going to be tolerable pain level, 0 to 3 out of 10 on the pain scale. Improved symptoms, it's safe and progress as tolerated. So a green light is a tolerable pain level, 0 to 3 out of 10 on the pain scale. These are activities that you can tolerate with no repercussions. There seems to be no pain or very minimal, and it seems to improve as the exercise goes along. During the green light phase, this means progress as tolerated. Add weight, sets, and reps as you see fit, and you can reassess the next day. But remember, slow and gradual progression will lead to long-lasting results and safe return to activity and reduce the likelihood of injuring or re-aggravating the area. This is where physical therapists can come in and properly progress the exercises according to how you're responding. Now, the yellow light is going to be an acceptable pain range. You have some mild discomfort, but it goes away after the activity. It's going to be 4 to 5 out of 10 on the pain scale. This is where we may have to modify the exercise somewhat. This way, we're proceeding with caution, you're adapting something, and seeing how your body responds to that change. Try modifying one factor. That could be the reps, sets, or weight, and see if it gets better, and see if your symptoms get better with that modification. Some of the modifications that could be made are reducing the range of motion, reducing the weight, reducing the reps, sets, and overall volume of that specific exercise. You could change the tempo, so going a little bit slower on a specific movement, allowing your body to make any changes or adaptations to minimize pain. And lastly, you can change the exercise or make substitutions to similar exercise that challenges the same muscle groups but may not be aggravating your symptoms. You can also increase your rest between sets. Another modification that can be made is increasing your cadence, so smaller steps, taking more steps in a given amount of time, changing the surface you're maybe running on to something a little bit softer, and changing the side of the road in which you're running on, because oftentimes the roads are slanted and you could be leaning to one side over the other. When it comes to returning to a sport, make sure you're taking more time in between your reps. If after you made your modification and the pain and symptoms don't subside or go back to an acceptable level, this may be a good idea to hold off temporarily and move to an exercise that doesn't stress the area as much. The red light is where you're going to have more of an intolerable pain level. Red light is going to be intolerable. This is going to be an exercise that is going to cause excess pain. This is going to be 6+ out of 10 on the pain scale. This is where we're going to want to avoid and substitute this exercise or this specific movement temporarily and seek guidance from a healthcare professional like a physical therapist to help you get back on track. We're not saying to avoid it forever. Just right now, it may be something that's provoking your symptoms further, and you may need to reevaluate if that exercise is worth the risk. You always want to assess the risk to reward ratio. If it's causing more pain, we may want to hold off temporarily. Remember, all lights eventually turn green. There's maybe some roadblocks, some detours, and it may take some time to get there, but you will get there. It'll be worth it, and you'll be able to return to the things that you love. Remember, this is used as a guide. When in doubt, seek assistance from a qualified medical provider. A physical therapist is a great option as they can rule out any red flags and get you back on track as soon as possible, modifying your activities as we address your underlying pain and symptoms.